Now to the latest on the coronavirus. Tonight we're talking about COVID-19, the Omicron variant. And while there are no cases of the variant in this country right now, the infectious disease doctor at UT Medical Center predicts we could see the first one within the week. 6 on Your Side reporter Lexi Spivak sat down with him and experts with the Knox County Health Department for what we need to know at this point. Lexi.
Lori, both of those health experts I spoke with say the fact that this variant was detected so quickly is a good sign. It gives us a bit of a head start in fighting it. And even though there's a lot we don't know about this variant right now, there are some important things we do know that could set it apart from other COVID-19 strains that we've been dealing with over the past 20 months. The Omicron variant emerging just after Thanksgiving weekend. The infectious disease physician with UTMC has been trying to learn all he can about the new variant. Dr. Mark Rasnick says it's the symptom that's missing that could make this more difficult to diagnose over the holiday season.
There is concern that it maybe starts as a more mild illness and might not have the loss of taste and smell that has become like the classic sign that people have COVID. Might make it a little more difficult to spot clinically.
While that would be a hurdle, Rasnick says there are several positives in terms of testing.
Fortunately, the currently available COVID PCR tests can detect this variant.
As far as vaccines go, he says it's still too early to tell just how effective they will be. However, he is staying optimistic.
It appears that there will at least be some protection from the vaccine against severe illness. People might still get sick in terms of have milder symptoms.
The director of nursing with the Knox County Health Department agrees. Dina Mashburn says the vaccine is still the first line of defense.
Until we can get everybody vaccinated, we're going to run into this problem because the more it spreads, the more it has an opportunity to change and create new variants.
Rasnick says it's not a matter of if we see this variant stateside, but a matter of when.
There's a good chance that there's already cases circulating in the United States, as connected as we are with the rest of the world with travel. So I would not be surprised if, this week there's reports of cases being identified in the U.S. That wouldn't surprise me. So I think we best should prepare for it.
Now, both of those professionals say it will be a busy next couple of weeks and months as they study the current confirmed cases of this variant across the world. They also remind people to get tested before attending any holiday gatherings if there's even a remote question that you could have COVID-19. Lori, back to you.
All right, Lexi, thank you so much. Now, nationally, President Biden spoke to the American people today as concerns grow globally over this new variant. Let's listen.
This variant is a cause for concern, not a cause for panic. We have the best vaccine in the world, the best medicines, the best scientists, and we're learning more every single day.
While more information is needed to assess Omicron's total risk, Dr. Anthony Fauci suggests getting boosted now and not waiting for the next iteration of the vaccine.